We're here today to discuss PRP and injections which can promote hair growth. In the US today, about 60% of US women have some element of hair loss, most occurring after age 50. Male patterned and female patterned hair loss are the most common causes of hair loss in the United States today, and that accounts for 5 million men and 3 million women each year. So there are a lot of remedies out on the market, some of which work, some of which don't. We're here to show you today PRP injections, which is platelet-rich plasma. What does that mean? It means that we're going to use your own growth factors to inject into your scalp to grow your hair. So what we're going to do today is we've already drawn some blood from our patient today, and we're spinning that down in a centrifuge, and we're going to get the serum from there, and in the serum contain platelets and cells with growth factors, and those are your growth factors that's going to promote your hair growth.
So we spun our patient's blood down in this tube and see how it's separated, and these are special tubes that have these little molecular magnets in them that will pull out all of the growth factors. So we're just going to prepare it and inject it into our patient.
We're going to inject our patient here today, who's a good candidate because it's androgenic hair loss and it's genetic. He does not have any underlying autoimmune condition that is leading to this. So PRP really isn't a good therapy for hair loss due to thyroid disease or anemia or any scarring process of the scalp. But for these most common causes of hair loss, it's great.
All right, so we have our platelet-rich plasma right here. We're getting ready to inject our patient. Just a little bit about the procedure. He's a good candidate because he does not have any scarring alopecia or alopecia due to any other causes. This is androgenic or pre-patterned genetic hair loss over time, and Bill's a good candidate for that. The procedure is 5 times in 1 year. You do it, you front load it, so months 1, 2, 3, month 6, and then month 12. So those are your 5 treatments. And we start to see results with hair thickening, stabilization of loss, and maybe even new growth around the 3rd treatment. So it takes a full 3 treatments, and we assess that at about 6 months after your first treatment. Right now, Bill has no anesthetic on his scalp. We do probably about 6 injections. The injections go in the area of hair loss, and there is some dissipation, so you have about a 4 centimeter spread, so it does overlap, so you get a larger area than where you're seeing me inject. We do use a Zimmer machine, which cools the scalp to help with the anesthetic effect, and we're gonna get started. I have Tristan helping me today. All right, Bill, you ready? All right, so we did about 8 injections. Billy, how do you feel?
Fine.
Feels fine. So the aftercare is pretty simple. You can get your hair colored. You can wash your hair as of tomorrow. We say no exercise today, but really that's it. Coloring is fine. Shampooing is fine. And he's going to leave here with no bandages, so there's really no other aftercare. We see him back in a month, take new photographs, and then he'd be all set. It should be noted that this is considered cosmetic, so not covered by insurance. And if you think you might be a candidate, we do consultations first just to make sure that we tailor the appropriate treatment and timeline for you.